Hey everyone, so I wanted to do a little quick update type thing um, because today was kind of a stressful day, let's just put it. But so anyways, in 2016, one of the medications I was trying, which was an IV, was Rocephin, and I had been on it before and it was no problem. I was tolerating it fine, somewhat sort of kind of helped me. I guess it maybe kept me stable. Um, but then I ended up stopping it for some reason to try something else. And then I went back to it or whatever. But when I went back on it, I ended up getting horrible, horrible, horrible gallstones. So, got the really bad gallstones, and I have been taking Ursidile or Actigol to hopefully break up the gallstones for like 6 months now, and I've been taking it 3 times a day. I don't think the medication really has any side effects, or at least I haven't noticed anything, but it's just like annoying, like just another pill that you have to take. So we have done a bunch of ultrasounds, and I had one done in October, and it showed just a shit ton of gallstones. And then I just had one again in February, and again it said that like there was no change. There was still a ton of gallstones. And we asked them to like count them or like do like check like the sizes of them to see if like I don't know, whatever. But they like couldn't even do it because so basically my gallbladder is pooped and it's just filled with gallstones. So I have been having like passing them, I guess. I don't know because I don't really know where they go, but I get like this crazy, crazy bad pain, and it's like all over here, but then it like shoots like right in the middle of your chest and it goes straight to your back, and you have horrible shortness of breath, and like it literally just feels like a heart attack. So when I was first having the attacks, we had to go like to the ER, and they treated me as if I was like having a heart attack because we didn't actually know that I had gallstones at the time. But now that like I know what it is, I'm just like dealing with the pain on a daily basis. So now for like the past few weeks, it has been daily pain, like pretty severe pain. And I don't know if like maybe I'm just so used to the pain now that like I don't think it's like as bad as it has been, but at the same time it's like holy shit, and it lasts for at least 6 hours, this horrible pain, and it's like nothing helps. You can't get comfortable. And if like I eat anything too, it makes it so much worse. And it doesn't matter if it's like fats or not fats. Like it can be like strawberries, and I have even worse pain. So I decided to go and speak with a surgeon today who I had already seen in 2016, but we decided to wait, see if it got better, but it obviously hasn't got. So when I went to go see her today, she was all very snooty, like, and my Lyme doctor is actually a nurse practitioner, and it's her own practice. And this general surgeon lady was so damn judgmental, and I mean, I'm used to that too. Like, isn't any Limey really? But she was just very like, well, it's a very complicated case, and I'm not sure if I'm like the best person to do the surgery, but I'm going to speak to your doctors and see what they have to say. And it's just like, Moose is barking, sorry. But it's just like super frustrating because it's like, I don't know. So she was like, well, it's a very complicated case, and you're obviously not like the rest of my patients who are like healthy and don't have all these infectious diseases. And so obviously like the risk with surgery would be much higher for somebody like me who is already very sick. And I don't know, it's like I don't want to have the surgery, obviously, because of all those reasons. But at the same time, then she's like, well, you know, gallstones don't go away, so the medication isn't going to do anything for you, and you're gonna have this pain for the rest of your life. So I'm like, okay, like, then shouldn't we do the surgery? Or are you saying that I need to be in pain for the rest of my life? Like, I'm already in so much pain, like joint pain and everything like that. So now I have to add more pain? I don't know. So I am just at such a toss up because obviously who wants to hear that you're going to have pain that could potentially actually be taken away, but this doctor doesn't want to take you on. So like, or you don't want to, it almost seems like she didn't want to take me on because she didn't want to like ruin her like track record of perfect surgeries or whatever. And honestly, like thinking about it, knowing all the risk and complications that could come, I still feel like I kind of want to go for it and just take that risk and have a chance at living more of like a pain-free life. But I don't understand, like, I don't know. I'd love to hear what y'all think and what your opinions are on this, because I'm so... And like, side note, I've obviously been to the ER for this, and usually when you go, they just like check you out and everything, and then they just drug you up with a bunch of pain medication. But I'm super stubborn and I don't like pain medication because I don't like that high that it gives you, and I hate not being or like feeling in control. So that's why I'm ditching the ER every time that this happens. But of course, in the back of your head, even though you're pretty certain you know what it is, there's always that like 1% that you're like, shit, maybe this could be something else and you don't really know. So what do y'all do in that situation? Because I pretty much just sit here, curl up in a ball and cry. So in the meantime, we will be waiting it out. She said that she was going to speak with my doctors and learn more about my case, but I got the vibe that she actually wasn't going to do that and she was just going to kind of toss me. But I guess we'll see what she has to say. But please, if you have any insight or advice or an opinion, throw it my way, okay? Just write me down a little comment or something, or send me a direct message on Instagram. That would be great too. And help a sister out, please. Thanks.